The regular meeting of the Minneapolis Police Conduct Oversight Commission will now begin.
Good evening. My name is Abigail Sarah, and I am the chair of the Minneapolis Police Conduct Oversight Commission. I'm going to call this meeting for November 9th, 2021 to order. As we begin, I will note for the record that this meeting has remote participation by members of the City Council and City staff as authorized under Minnesota statutes, Section 13D.021, due to the declared public health emergency. The City will be recording and posting this meeting to the City's website and YouTube channel as a means of increasing public access and transparency. This meeting is public and subject to the Minnesota Open Meeting Law. At this time, I'll ask the clerk to call roll so we can verify a quorum for this meeting.
Commissioner Crockett. Commissioner McGuire.
Present.
Commissioner Pino. Commissioner Sylvester.
Here.
Vice Chair Sparks.
Present.
Chair Sarah.
Present.
There are 4 members present.
Let the record reflect we have a quorum. Next, we'll proceed to our agenda, a copy of which has been posted for public access to the city's Legislative Information Management System, which is available at lims.minneapolismn.gov, and the acceptance of the minutes from the meeting of October 12, 2021. May I have a motion to both adopt the agenda and accept the minutes?
This is Commissioner McGuire. I move to adopt and accept the minutes.
Thank you. Is there a second?
Commissioner Sparks, I'll second.
Will the clerk please call the roll? And I note for the record that Commissioner Sylvester is joined.
Commissioner Crockett.
Aye.
I meant to say Crockett, sorry.
Commissioner McGuire.
Aye.
Commissioner Pino. Commissioner Sylvester.
Aye.
Vice Chair Sparks.
Aye.
Chair Sarah.
Aye.
There are 5 ayes.
That motion carries and the agenda is adopted and the minutes for the October meeting are accepted. Next, we'll move on to discussion of nuisance misdemeanors. And we have 3 guest speakers this evening. The first is Professor Manjit Rege from St. Thomas University. He's the department chair of software and data science, and he prepared a presentation for us this evening. And I believe that the presentation will be presented by the city clerk for those who can see it on Teams. So Professor Rege, thank you so much for your work and thank you so much for being here. Please take it away.
Sure. Thank you so much. And hi, everyone. So my name is Manjit Rege. I am the Department Chair of Software and Data Science at St. Thomas, also the Director for Center for Applied AI. I was approached by Commissioner Sarah to analyze the nuisance misdemeanor data set, and I've done my analysis about which the presentation would be shared by, I believe, the clerk. So I'll briefly go over my presentation very quickly here. Next slide. So what I right away establish here is the demographics of race in the city of Minneapolis. 63% whites and 19% blacks. So this is from census. I'm mentioning this right up front because what you see later on when you look at the misdemeanor incidents is something that is completely flipped. Next slide. So in the data set that was provided, there were around 8,011 incidents of the 6 misdemeanors that you see at the top. And those were I believe public urination, consuming in public, loitering with open bottle, interfering with pedestrian traffic, possession of drug paraphernalia in public, loitering, and disorderly conduct. So those were the 8,011 incidents. Next slide, please. Um, I was also asked to look at, is homelessness a factor in these incidents. Now, um, detecting homelessness is a little bit challenging. Sometimes you have address missing, or the address could be not recorded. A homeless person could give somebody else's address, like a relative, so that doesn't get discovered or doesn't get recorded as uh, a homeless. Um, we also took into consideration, if the address is that of Salvation Army, then we'll count that as homeless. So we have tried to do our best to estimate the proportion of homelessness. Overall, of all of the incidents, 7.26% were homelessness, so not a big proportion. Next slide, please. So of those 8,011 incidents, the 6 misdemeanors, this is how they were distributed, with half of those coming from the interference with pedestrian traffic. Next slide, please. And then I am breaking it down by the different kind of misdemeanors. So I'll explain this one, and then the others would be kind of similar. So this is for the consuming in public. What I have tried to show here is, in on the left, those are the arrested incidents with the blue color. On the right is the citation incidents. And on the bottom, you would see the different races recorded. So here you would see that the proportion of blacks is high at 62% compared to whites, which is 23%. So basically, you have 3 times almost, right, blacks compared to whites. And if you look at the population demographics, it is the other way around. So this is for one particular misdemeanor. And I was also asked to look at, is homelessness again a factor? Next slide, please. Um, so around 14% homelessness just for this particular misdemeanor. And then, so this is for one particular misdemeanor. I then did this for the remaining 5 as well. If we can have a look. Next slide. So this is for disorderly conduct. The proportions differ a little bit. Sometimes you can see, so here it is 26 to 63%, but primarily you will see that blacks are significantly higher, sometimes twice, sometimes thrice. Next slide. This is for homelessness. Next slide. So this is for loitering. Again, you see extreme differences. Next slide. All right. This is for loitering with open bottle. Next slide. Again, big differences in the races there for the arrest and citation. Next slide. Proportion is around 12%. So you see that the homelessness proportion is in that ballpark always. Next, please. This is for the possession of drug paraphernalia in public, 19 to 63%. Next slide. Homelessness, 16%. Next slide. This is public urination, 22% whites, 60% blacks. Next slide. So 10% homelessness for this particular misdemeanor. Next slide. And this is for the interference with pedestrian traffic. This accounted for, if you remember from my first slide, half of those incidents, around 4,000 of the 8,000, were in this particular category. And here you see again 13 to 30%. And that should get me to our last slide, which is just showing for this particular misdemeanor, 1.28% were homeless. So I would be respectful of the time, and that is what I had to present.
Thank you, Professor Regge, for putting all of that together. Does anyone from the commission have questions about how he analyzed the data or put together this presentation? I want to be mindful he has a prior commitment. Please press *6 to unmute yourself, commissioners, if you have a question for Professor Regge. Okay, well, Vice Chair Sparks.
Hey, I just had a quick question for you, Professor.
Sure.
On the racial breakdown, I think what I'm looking at, I just see on the columns A, B, I, U, W. Is that Asian, Black, Indigenous, Undetermined, and White?
That's what I believe. Yeah. I mean, I
Okay.
had a discussion with Commissioner Sarah about that. Yeah. Yes.
Okay, perfect.
Yep.
Thank you.
Any other questions from the commission? Thank you so much, Professor Regge. We really appreciate your partnership. It's so welcome. Thank you very much.
No problem. No problem. Thank you so much. If you don't mind, I can drop off, right?
Please, or I mean, if you, very good. Thank
Sure.
you.
All right. Thank you.
Okay.
Bye-bye.
And moving on to our second presentation by attorney Sean Webb. Mr. Webb is the managing attorney for the Gross Misdemeanor and Misdemeanor Division of the Hennepin County Public Defender's Office. And that's the particular division that handles nuisance misdemeanors. So he is, you know, acutely aware of this kind of offense and what it looks like in the court system. So Mr. Webb has prepared some remarks for us this evening. Mr. Webb, please take it away.
Thank you. Just wanted to follow up on a couple of things from the professor's presentation that I used as kind of jumping off points, particularly looking at the racial data that he gathered and analyzed, and the homelessness data that he gathered and analyzed. And I think he even talked, or I don't think, he did talk about some of the limitations based on the information that he had available to him in trying to properly gauge the impact or the percentage of these cases that involve people who are either homeless or experiencing housing insecurity. And I think the percentage he gave for the overall was 7.62%. And when I look at the breakdown or the clients that my office represents, I think that's a lower than what I suspect the actual percentage is. I think there's a couple of factors in that. One was the very large category of the 4,000 pedestrian traffic interference cases that had an incredibly low percentage of homeless or people who are identified as being homeless, kind of skewed the data. The other aspect that I think plays a big role is that there's a significant amount of stigma attached to being homeless, and there are a number of steps that people will take to try to not be identified as being homeless, and certainly something that for a large percentage of my clientele, it's not a designation that they are choosing. It's a designation that is often foisted upon them by other circumstances. So I think some of his comments about not being able to capture the percentage of people who are maybe using a family member's address even though they're not living there, or maybe they are using an address that they're staying at very temporarily. I think if I was going to anecdotally put a percentage, I think we're probably looking at somewhere between 15 and 20% of the people that my office represents that are charged with these offense categories that are probably either homeless or struggling with housing insecurity. The other data point that I wanted to just jump off of from the professor's presentation was the racial disparities. That is certainly something that's consistent with the data that my office gathers and the data that I see from the courts and from other agencies that are tracking the racial disparities. My office, this year we started our own internal tracking to better ensure the quality of the race data that we're relying on for trying to address some of the systemic disparities. And one of the limitations of my office's internal data is that I don't have the ability to just break out the city of Minneapolis cases from all of the other misdemeanor and gross misdemeanor cases that my office represents, which would be the entirety of Hennepin County. But for comparison purposes, I pulled the numbers, and the percentage of clients that my office represents that are charged with these types of offenses was 51% of them were self-identified as African American or of African descent, versus 27% self-identifying as Caucasian or white. So slightly smaller disparities than the data that the professor presented, but again, that's across the entirety of Hennepin County, not just Minneapolis, but still a staggering disparity when we're looking at the population percentages. So I think the real life impact that I'm seeing in the courts is certainly consistent with what the data that the professor presented on. One of the things that I think gets lost in some of this data is the actual impact that these types of charges and arrests and prosecutions have on people. And thinking about this from a very human perspective, what it means to be engaged by law enforcement, even if it is for a relatively minor offense, especially for a population that is particularly vulnerable, like our homeless population, or people who are struggling with mental health disorders, chemical use disorders. And so just that stress of the interaction itself, I think, takes a toll on people. Then you layer on top of that the impact of actually being arrested and having their freedom taken away from them, sometimes for a very short period of time. Sometimes they're arrested, processed, and then released within a matter of hours, sometimes for a much longer period of time, whether that's a handful of days while they're waiting for a court appearance, up to, in certain circumstances, it could be several weeks or even more than a month. For people who are already struggling to maintain some stability, that type of disruption is incredibly damaging. One of the things that I see over and over again for my clients who are struggling with other, to address other issues in their lives, the arrest and being detained in jail really just knocks over whatever progress they've had built up, whatever stability they have worked very hard oftentimes to build. That arrest just completely wipes that progress out. It deprives them oftentimes of the treatment that they may be participating in that is helping them, address the issues that they're struggling with. It may deprive them of the access to the medication that they need to address their mental health or their medical conditions. And so it really has a very damaging effect. And for almost all of these offenses that we're looking at, we're talking about a huge potential damaging impact on the person being arrested and detained, and really negligible benefit for society, and negligible benefit when we're looking at addressing public safety, because by and large, these types of offenses are not the springboard into public safety type of offenses. These are not the types of offenses that are springboarding in, people into assaults or springboarding people into operating a motor vehicle while they're impaired, or springboarding people into the more severe end of the spectrum of cases that the criminal justice system handles. And so we're inflicting oftentimes a huge amount of disruption and potential damage for really not much gain or not much benefit, especially when we're thinking about, if as a society we've decided that these types of behaviors we want to discourage. Well, arresting somebody, placing them in jail, destabilizing their entire life, when they come out the other side of that, they are in either the exact same position that they were in that caused them to be engaging in the behavior that they were arrested for, or they're in a worse position than they were in. And these offenses are not, I've said before that these are not offenses where people, these are crimes of desperation, not crimes of volition. These are not crimes that people necessarily are choosing. They're oftentimes crimes that are being committed out of desperation or lack of other options, or lack of access to resources to really address the needs that the person has in their life that they're struggling with. And so when we're looking at crimes that are being driven by lack of resources and desperation, arresting somebody, prosecuting them, convicting them, incarcerating them, all of those things really are geared towards, punishment or retribution. And these types of crimes, punishment, retribution, when you're dealing with behavior that's caused by desperation, doesn't really deter the behavior, because the person is oftentimes making a very difficult choice between unappealing options. They don't have good options to choose from, and they're trying to pick the best of bad choices or bad options. And so the typical kind of criminal court deterrent model of punishment or retribution doesn't seem to effectively detract from this type of behavior. What we've seen be successful in reducing this type of behavior is, helping these individuals get access to the resources that they need to address the issues that they're struggling with in their lives, and to really help them find the stability that most of us take for granted, and find the stability to start building positive progress on. And once, I've seen clients time and again, once they have access to the resources, they have a more stable life, they're addressing those issues that they were struggling with, almost always this type of behavior stops, because these were not behaviors that they were choosing because they wanted to. This was behavior that they were engaging in because they had no other options. And so I think that really looking at this from a practical standpoint of what will help, if we've decided that this behavior is not what we want as a society, how do we minimize it or reduce it? Arresting people, charging them, convicting them, incarcerating them doesn't really effectively reduce it. Finding ways to help these individuals get access to the resources that they need to build stability in their life and to address the underlying issues that they might be struggling with, that has shown to be a much more successful way of addressing or reducing this type of behavior. And one of the things that I point to is kind of an example of how this can be successful, and to the extent that it can be successful, is one of the programs that my office has worked with the city of Minneapolis and the city attorney's office on is a partnership between us, Minneapolis, and Hennepin County social workers, where clients who are my office's clients who are charged with these offenses that are interested in trying to access resources and trying to address some of their underlying issues are being supported by Hennepin County social workers and given help in navigating through the available resources and addressing the needs that they might have. And the program is called Restorative Court, and this started in 2018. And so we've got a couple of years of data looking at the clients who've successfully completed this court, and looking at over the last 3 years what percentage of those individuals were back in court on new charges. And when we looked at the data, most recently at the beginning of 2021, the recidivism rate, or the rate in which people in this program were being brought back into court on new charges of this type, had dropped 70% versus what that category of cases, the recidivism rate had been for individuals not in this program or before we had this program. And so that's an incredible reduction. And if I was going to say what accounts for that reduction, it is giving these individuals the opportunity to access resources and to find stability. And I think that if we focus on that, we're helping these individuals, but we're also reducing the behavior that society has said is objectionable.
Thank you so much, Mr. Webb. And I'm mindful of your time here. Commissioners, does anyone have any questions for Mr. Webb? I'll recognize myself and ask you a question, Mr. Webb. When you presented in the subcommittee, I asked the same thing. Do you have a sense of what percentage, or just roughly what percentage of this population, these nuisance misdemeanors, impacts people struggling with mental illness? We weren't able to control for that in our data set. There isn't like a check mark or anything.
Yeah. So I think that if we're looking at the broader range of individuals who are brought into the criminal court system, there's been a handful of really wide studies, and the percentages are astounding, anywhere from 50% up to I think the Federal Department of Prisons issued a report that 66% or 65% of their federal inmates were suffering from a diagnosable mental illness. And so I think that there is an astounding amount of mental illness or mental health struggles that people in the criminal court system are dealing with. And I think that when we look at this population, especially factoring in the homelessness, that we're looking at, if not a similar percentage-wise, probably even a slightly higher percentage-wise of individuals that are struggling with some type of mental health disorder, because that tends to be one of the it is one of the most destabilizing things that people can struggle with, and not having access to a psychiatrist or to a counselor or to the medication that might be very beneficial tends to be the triggering events that people struggling with mental health disorders, that tend to kind of, if the person has access to those resources, they tend to be able to stabilize. They tend to be able to find ways to effectively manage those mental health conditions, versus individuals who don't have that luxury of those resources. The mental health conditions tend to spiral them down, and oftentimes there's an interplay between the mental health struggles and then chemical use abuse And so there's multiple facets to what bring people into the criminal court system and being charged with these types of offenses. But I think that the really the biggest two are going to be the mental health conditions and then the substance use disorders. And like I said, they oftentimes intertwine with each other to really to kind of have that really detrimental 1-2 punch for people, and it really knocks them off their feet in a lot of circumstances.
Thank you. Commissioners, anyone else have questions for Mr. Webb? Going once, going twice. Mr. Webb, this has been incredibly helpful, and we really appreciate your expertise and your perspective. And if there aren't any more questions, we will release you. Thank you so much, and I'm sorry to go a bit over time that we scheduled.
No problem. And if there's anything else that me or my office can do to help the commission, just let me know.
Okay. Thank you, Mr. Webb. Okay, that brings us to our third speaker of the evening, Lieutenant Mario Roberto from the the Metro Transit Police, and I've just lost his bio. I had his bio pulled up here. Excuse me. He has over 38 years of public health and safety experience and holds a master's of arts degree in police leadership, administration, and education from the University of St. Thomas. Prior to entering law enforcement, he was a paramedic for HCMC for 22 years and a cardio care nurse for the Mayo Clinic. He's currently a lieutenant for the Metro Transit Police Department. He spent three years in charge of internal affairs, the department's emergency manager, and he helped design and develop the department's first homeless outreach program, which focuses on developing alternatives to criminalizing the behavior of vulnerable individuals. You can see he's quite the expert and precisely the expert we need to help us navigate this issue with the city. Thank you, Lieutenant Roberto. Please take it away.
Well, thank you so much for having me. I think for me, coming as a paramedic for 22 years in the city of Minneapolis, and then moving over to the transit police, it was quite a change for me to be out on the streets and start to see the same people that I saw as a paramedic. So from a medical standpoint, I'm seeing people who've got mental health problems, who've got other issues. Yet from the police lenses, the officers that surround me without the medical experience tended to see disorderly conduct and other problems that would lead someone to incarceration. And so oftentimes, especially with trespassing on a transit system, you basically start to force people to break the law because they've got no other place to go. So I've got myself in as a new officer, as a rookie officer, it was a little difficult for me because I would say, well, I think they need to go to the crisis center or they need to go to here. And that's not exactly how it was going to go on my field training. So it was definitely a challenge. And when I got off of that, I ended up being promoted. And as part of my promotion, everybody had to take on a problem-oriented policing project. And I decided at that point that I would look at how to decriminalize how we were handling our outreach to the people who were homeless. And so I started and ended up creating the Homeless Action Team. And so we've advanced from there. And one of the things that I really noticed being on the street was that a lot of the same people that I ended up seeing would, we would be going back and forth with the paramedics. So the paramedics might show up because we get called because the person is a one down or they're down on the pavement and we get there. And as a paramedic, when I was a paramedic, if they could stand up and walk, they would generally go into the squad car. If they could walk fine and they could go off on their own, we might let them go unless it's the dead of winter. And or if the squad was going to take them, they would take them to jail, or they would take them to wherever they might take them, or we might leave them. So it's a either detox, emergency room, or jail option, and so it becomes a little bit difficult for us to make those decisions. Next slide, or a slide. I don't see any up there. Does anybody else see the slides? Or? Oh, there we go. So next slide. There we go. I think this kind of demonstrates a lot of also what Sean was saying too, and that is, as confusing as this slide looks, with so many, different circles in it and such, it really demonstrates that deep connection between mental health and substance abuse and other chronic health problems that end up leading people into being, meet up with the police or meet up with the paramedics, and then they end up in the emergency room or they end up in jail. And oftentimes it's because we don't have any other place for them to go. So without any other pathway for us to go, we have to pick one of those three or leave them be where they're at. And then the next call that comes in, when the police respond out or the paramedics respond out, then something needs to be done. So they'll have to go somewhere. Now, we often bring them to the emergency room. And when we get them there, the emergency room staff might say, well, they were just here yesterday, or they were here the day before. And, they're not complying with their medications, or, so it won't be long before they let them back out their front door. And then they end up back out onto the street again, and this whole vicious cycle of instability continues, and we see them back again on the street. Next slide. So one of the things that over in St. Paul, when I spent a lot of time over there, I started working with like St. Paul Fire and the St. Paul PD, their coast unit, and we started to look at who really takes up a lot of our resources. And so we sat down and identified 30 people, and of those 30 people, we had 740 contacts in a year, 197 citations, 148 bookings, and 249 transports to the emergency room by the paramedics. And so when the paramedics take somebody, you're talking about probably a $3,000 or more transport to the hospital. You're talking about being admitted into the emergency room at a certain cost. And then the same people getting arrested or cited. And then, that may create, a block in their pathway to being able to be housed. So we didn't have a whole lot of other alternatives. And it's always, a problem when the paramedics and the cops get out there and the cops are going, no, you take them, no, you take them. Then you get to the emergency room and they're like, well, we can't help them. We've already tried. And so we don't have any alternatives. So one of the Familiar Faces project is something that I had come up with as a concept, but began working with a group over in St. Paul, and the project manager being Ellen Waters and Roger Myers. We started to look at, well, who can we kind of bring together that are experts and start to talk about what our possibilities are. And that's when we brought in some outside consultants, and we started having meetings about how this might look in concept, and how we might help decrease the resources and the enormous amount of resources that we spend on the 30 people that we're seeing, and try to do something that can create maybe a little bit more of a permanent solution for them. Next slide. So the Familiar Faces implementation idea, the plan would be to have, another alternatives. Where can we go beside jail, beside detox, or beside the emergency room? And that model would be creating something where we would identify the individuals that are the Familiar Faces. So when they are triggered, whether it be through the police dispatch or the paramedic dispatch, and most of us, of all the years I was on the street as a paramedic, when you pull up you'd say, oh, that's Jim. That's Jim again. Oh, great. That's Jim again. So we know who most of the people are that we see out there. And so it's not an unusual thing to see them more, on a daily basis. So this would give us another place, another opportunity to bring somebody to somewhere else. And then, more of a harm reduction model on where we would go and bring them. So the place would have 24-hour security, and there'd be peer specialists and people that can follow them and create and tailor treatment, and also the people that are in that model will, the local court system will know about them. So if we have an issue and somebody tags them for something, and we need to fix certain things so that we can make sure that we don't block a resource because we have a ticket for trespassing or something else. We have that ability to work closely with those familiar faces. And then keeping it small, keeping the group small allows you to test your proof of concept and make sure that it's working, and then an additional 30 might come in as soon as you provide a pathway for better stability for the individuals who are in the program, and move to that next group. Next slide. So when we looked around the country at different things, one of the models that we loosely were basing a lot of the familiar faces on was the frequent users program. You see it a lot on the East Coast, and the different places that have been using it shows that by moving people into housing and then being able to follow them closely, that you're decreasing the amount of time that they're spending in the hospital, significantly. The inpatient charges, inpatient days for people who were permanently housed decreased by 27% versus those that were not and they remained homeless grew by 26% on inpatient charges and 49% on the ones that were homeless. So the FUSE program had 86% of the population that were in the program were still housed 2 years later. So there was a great amount of success in that particular program. And so when we look at some of the people that we see that are our familiar faces, we see them, and we'll see them again this year. We'll see them again next year if we don't do anything. And I think there's a lot of resources to get spent, on the easy lifts, the low-hanging fruit, so to speak, to say, well, we can lift these people up fairly easily. So we'll spend our money on that. And so, but it doesn't give the paramedics or the police officers an alternative but to arrest somebody, because that might be the only way we're going to get somebody in somewhere warm in the winter, or they end up on the transit system, which obviously doesn't bode well for us over here at the council. So the idea here was to create something different, and then to move in that direction, so that we could create a better pathway for people. And I think that was the last slide, but I don't know. Yes. So it's going to be an ongoing challenge. It continues to be, and again, we'll see the same people over and over again if we continue to look the other way. I think that's all I've got for this presentation.
Lieutenant Roberto, I am going to open it up, but just a couple call outs. One, we've had some meetings, Commissioner Sylvester and you and I have had some meetings where basically we discussed that it's not like law enforcement officers wake up in the morning and they think, I hope I arrest 10 people for public urination today. Like, that's just not what cops want to do. Right. But you pointed out there might not be an alternative today to just an arrest. Like, that's their option, that's their tool. So just so I'm clear, this isn't saying like, this isn't like an anti-police kind of thing. This is like a tool. This is a place that police officers can take people or you know, this is something we can all do together as a community to really try and lift up and address chronic, what do you call them, high frequency individuals.
Correct. And it's not just the police officers that would, then the paramedics would know that that would be an opportunity to bring somebody somewhere. And then the emergency room the same way, because the emergency room has to release people. And when they release them, sometimes they end up right out on the corner of, 7th and Chicago there, right at the bus stop or wherever else. And they're going to be right back in the eye of the public again. And it's the public that calls. So even if the police get there and we leave the person, it won't be long before another call is triggered by somebody else. And at some point or another, we can't just keep coming there and leaving people. So if there's an alternative for someone, especially that we're going to see over and over again, and we do, in the 22 years I was a paramedic on the street, to moving to being a police officer on the street, I saw many of the same people and I knew them by name when I showed up. And it was because I knew them by name because I saw them as a paramedic.
Any questions from the commission for Lieutenant Roberto? And also I just want to call out that Commissioner Sylvester has been doing so much work on this front for the past 6 months, and Commissioner Sylvester introduced me to Lieutenant Roberto and kind of made this connection, and he's been guiding this work. So expressing my gratitude to both Lieutenant Roberto and Sylvester. Does anyone have any questions for our speaker tonight?
Yeah, I got a quick one there. And first off, appreciate the presentation. It's really awesome, very insightful, and just wow that there's so few options. My question, and I might have missed it, but you mentioned there's like short-term incentives for like engagement. Could you go back over that?
In the past, they've had some success, and this goes back, 20 or more years, where they would there'd be some mild payments for keeping yourself a little bit more straight and not how many times you interact. End up seeing, so let's say you're a familiar face and we have a place to bring you, and you go back there, but you still ended up in jail or you ended up in the emergency room 2 or 3 times. There might be a stipend each week that you would not get then. So that's been used before with success. Obviously, it can be a little bit controversial, but sometimes people need something a little different to maintain. They might think twice. They go, okay, oh boy, I'm going to lose my $100, or I'm going to lose my $50, whatever it might be, because even if it's $25 or $50, that's still a lot when you're on the street or when your means are limited. And it's all proof of concept. It's all concept right now. So it's all something that, obviously it's flexible, however the program is implemented. But health partners and others had already looked at, what sort of donations or what sort of assistance that they could give, because obviously the healthcare system is burdened in cases like that. And so when you look at your community paramedics and your others that go out to housing, that's meant to keep people out of the emergency rooms. That's meant to assist people and decrease the cost of healthcare. And so this is certainly all in possibility as far as who might be part of it.
Thank you. Commissioner Sylvester, I see your hand up.
Lieutenant Roberto, thank you so much for coming tonight and kind of sharing with everybody the stuff that really gets me excited about this work. To my fellow commissioners, if you ever really want to get kind of recharged about the relationship between homelessness and kind of progress and the people that are doing this right and stuff like that. Like, look into Metro Transit PD and look into the homeless action team and look into the work that they're doing. And it will fill you with excitement about the work that we're doing here, because it's kind of right in the same vein. And it's the folks that you really want to see. And it's super exciting. Lieutenant, what is happening in St. Paul right now with this program? Like, is the city of St. Paul on board right now as a partner? Like, what's the process right now?
I think it's well organized. They love it. Obviously, they like the idea and the concept, but in all that's been done, it's really kind of come to a point where it hasn't gone to the final part of the conclusion, and other things have kind of stepped in, and I think part of it, regions and others, it's kind of a HIPAA thing of, well, how do I truly identify the people, and how do you, so, and I think there's a little bit of mission creep as other people say, okay, well, if we get this for a safe haven, can we add these people to it too, or can we do this? So I think looking at it through the lenses of a new group after it's already been brought this far might be an easier lift. But I think it had well support of the mayor and everyone over there, and it just has not gone further at this point. So it's kind of, I think it's up in the air and ready to move if anybody wants it, I guess. And it may come into play over there, but at this point, I don't see it happening for a while.
So it could be, we could stand it up in Minneapolis.
You
Right.
can. Yep. Yeah, there's nothing stopping you. And and I made sure that both the project manager, Ellen Waters, she gave me the additional stuff that we've all turned in and gone over, and I gave that Commissioner Sarah to hand out. So she said, go for it. I mean, it's something that we want to see developed, even if it's on a small model, because if it works on a small model, you don't want to get it too big at first, because if you do, then it may just get, it may be too hard to do, versus if you did it with 20 people or less, or even 15, you're more likely to find a place, you're more likely to find and have that ability to bring in the people to treat and to focus treatment on them, and change their lives.
And just for clarification, I've been throwing a lot of stuff out there tonight. This Familiar Faces program, this is for a very narrow group of homeless people with high frequency nuisance misdemeanors. It's not just for like someone who gets 1 or 2 tickets for public urination. This is for, we're talking about a very specific narrow group of people with a lot of co-occurring issues.
Correct.
Yeah.
And if you look at what those statistics were for the 30 people, it's amazing. You're talking about 740 contacts for 30 people, talking about 240 transports to the emergency room, and the charges that go along with that are enormous. And it is the people, as paramedics and police officers, we know them by name. You show up, it's like, whoop, and you walk out and you call them, they know you. So we know who they are, and it's those people that need help too that we tend to look over, because it's too hard. And well, if it's too hard in a year from now, it'll still be too hard if they're still alive. But we have that chance to kind of give them back to their family and whoever else, but and anybody else that's given up on them. But if we don't, they'll be there again on our next shift.
Does any other commissioner have a question for Lieutenant Roberto or comment? I do have this, he gave me sort of an information sheet. It wasn't quite ready to be put on the public agenda and sort of bounced around the city, but, you know, behind the scenes, we can, if any individuals would like that, I can share that. Commissioner Crockett.
Hey, oh, one more question there, and I'm sorry if I might have missed it or so. But what were some of the ideas or things that were talked about as far as like funding and or ideal funding concept or infrastructure for that?
You know, the county, the city, the mayor's office, and others had all looked at putting funding in. Health Partners had, you know, when I did the initial discussion at the mental health roundtable over at Regents Hospital, and Mayor Carter was there. That's kind of where he took it on, you know, for the city, like the concept. And Health Partners was already talking about, yes, that it would be something that because it would decrease medical and other expenses in the long run by keeping people out of the emergency room and not paying for that ambulance ride. You know, that it's those are value. That's value that they can give back to the community by investing in it. So I think that there were other, you know, foundations and such that would likely be interested in a concept, especially since, you know, we've really spent a lot of time kind of working out a lot of the way it should look and what would be successful.
Thank you.
Awesome.
We do have the Minneapolis Foundation, for example, and you know, HCMC and other medical partners, and so we kind of have analogous partners on this side of the rivers we work with too. Any other questions for Lieutenant Roberto? You know, we have a lot more discussion to go, but he's been very gracious with his time. And if we don't have any more questions, I'd like to release him. Okay, thank you so much. I just can't thank you enough just for your dedication to addressing the needs of the homeless population and giving us this really constructive thing to do. I mean, this is what we've been waiting for. So thank you so much, and hopefully we'll be in touch.
Thank you, guys. Have a great night.
Okay, so that was like a dream team of speakers. There was one other speaker who wasn't able to make it tonight, Harvard Law professor Alexandra Natapov. She couldn't be here tonight, but she did address the Policy and Procedure Subcommittee on May 27th of 2021, and that her remarks are available on YouTube. So there's a problem with LIMS where we cannot hyperlink a YouTube video, so I wasn't able to hyperlink it to this agenda. But if you go to the city's YouTube channel and look at the May 27th, 2021 Policy and Procedure Subcommittee meeting, Professor Natapov speaks from the 15-minute timestamp to the 32-minute timestamp, so it's about a 17-minute presentation. And she also gave a real, you know, real knockout discussion of how misdemeanors, particularly these nuisance misdemeanors, they just cast this very wide net and bring people into the criminal court system in a very negative and harmful way. And if we really want to be serious about addressing police reform and criminal court reform, we have to look at misdemeanors, not so much the felonies. I mean, misdemeanors is really where this work is done. She gave a really great talk, so I encourage everyone to watch that. And if Commissioner Sylvester has any comments, Commissioner Sylvester was at that meeting. With that, I would like to open up the discussion of nuisance misdemeanors. And I would like to just kind of give a summary of the work we've been doing in the Policy and Procedure Subcommittee. We've been doing this for about 6 months. I occasionally bring updates here to the full commission, so it's kind of gone back and forth a little bit. But Commissioner Sylvester and I thought that we've kind of reached the peak of the work that we've been trying to do, and it was ready to bring to the full commission for a discussion. I have attached some additional resources to the agenda. One is Professor Rachel Moran wrote a law article specifically on disorderly conduct, like that specific misdemeanor, and how that is problematic and has very specific concerns. There's also a Suffolk County study out of Boston that looks at what happened when the prosecutor in Suffolk County, Boston, just stopped prosecuting livability or nuisance misdemeanors. And people thought that other kinds of like crime would skyrocket because there was no prosecution and, you know, just like the sky would fall and everything. And actually what they found in Boston was that crime went down. And it was a net gain for the community to stop prosecuting these very specific kind of misdemeanors. So that's an academic study. It's like 68 pages long or something like that, but a good resource. I also added the Cohen study of the cost of homelessness because, you know, Commissioner Crockett asked a good question about funding. None of this is free. All of this costs money. What the Cohen article said is that if you invest in homelessness services like the Familiar Faces program, housing, social services, medication, that kind of thing, it does cost money up front, but financially it benefits the community that makes that investment. You actually get a return on your investment because in the same way that Lieutenant Roberto was speaking of, you kind of get the people out of the really expensive, like a constant cycle of emergency room visits or spending a night in jail or going to court, and you kind of level them out, get them back on their feet, and they can be productive members of society. So there is an upfront cost to it, but the city gets that cost back, you know, actually in the Cohen article within 2 years. So kind of supporting what Lieutenant Roberto was saying. And in terms of a group of people that Minneapolis could work with, we actually have a very specific group of people. There is within Minneapolis a project, it's called the Strategic Justice Partnership, or SJP. It used to be called Downtown 100. It's a group of high contact, high frequency individuals. It's that same group of people who have a kind of like the chronic arrest, emergency room, jail kind of cycle. The list is right now at 23 people, and I did attach that to the agenda. It kind of hovers around 20 to 24 people. And looking at racial demographics, it's almost exclusively Black and Native American people on that list. So, and almost everyone on that list, I can tell you I was a public defender and I represented many individuals who at the time were on the Downtown 100 list. Almost everyone on that list has serious and persistent mental illness coupled with drug or alcohol addiction, or, you know, some kind of combination therein. So you're really dealing with people with very acute, specific needs, and you can't do the same thing for them that you would do with other groups and just expect everything to work out. Like, you need something else. And when Lieutenant Roberto gave his presentation to me and Commissioner Sylvester, I mean, I almost started to weep. I was just like, this is what we need. This is the thing. Like, I've been waiting for this. I've been waiting for this moment, and here it is. And he's done the research, and he's got all the statistics, and he's got so many community partners lined up, and, you know, he's got law enforcement partners lined up and medical professionals lined up, and that's what we need. We really need this holistic community response. It can't just be one group. So kind of the culmination of all this research and study, all these guest speakers we've had, seems to be pointing us in the direction of providing services to one, like, special group of people. And in Minneapolis, we actually have that pilot group with the SJP, or the Downtown 100 group. So I've been talking a lot. I'd like to open it up. Would any commissioners like to ask a question, offer an opinion? You know, please. And I apologize for making you read like 300 pages of academic articles before coming to this meeting. Commissioner McGuire, calling on you.
No, thank you for bringing these presentations in. And I just want to say this also, like similar to your experience, Commissioner Sarah, I do immigration law and work in deportation proceedings, and this is overlaps with the communities that end up, especially Black immigrants who end up in deportation proceedings, who, when they get arrested, rather than maybe sent to some mental health services or a safe haven, those arrest reports, there's no evidentiary standards in immigration court. So those arrest reports make it into the record and are part of their proceedings. So it's kind of almost a double whammy there when someone is not a U.S. citizen. And so I'm just interested in how we can best advocate for this programming. I think it's something our commission should be looking at. And I just want, I'm happy to want to learn more, just basically how we can support the creation of it, because it seems like the funding should be city funding or county funding, so that it can be based on residency locally, geographically, rather than citizenship or something like that.
That's such an excellent point, and I love that we have so many people with different professional expertise. I didn't even bring up the immigration aspect, but that's absolutely right, and it's so imperative for us to think about. Commissioner Sylvester, did you have any comments or questions?
Yeah, for me, this I met Lieutenant Roberto about 1.5 years ago when I started to get into homeless work at HCMC, and kind of trying to figure out how we can build a better service model to the unsheltered patients that we serve. I ran into his homeless action team, and their really groundbreaking work that they're doing with unsheltered folks. For this type of work, when we talk about funding, we have the city of Minneapolis involved, we have the county involved, we have Hennepin Healthcare involved on our side of the river primarily, and then we also have Metro Transit, and the Met Council, who oversees Metro Transit, and that Met Council reports directly to the governor in a lot of respects. And so there's a huge funding stream available, and there's a lot of different very well-funded entities that touch this population on a really regular basis. And so when we think about funding, when we think about who to approach, when we think about advocacy, this isn't just, let's go to the mayor, right? Or let's go to the county board. This is, let's try to spread this cost across a number of different entities. I still feel like our city is crying out in a lot of ways for very practical, very applicable public safety change. And it's not, pardon the expression, but it's not flashy, right? Like low-level misdemeanor stuff. It's not the big kind of home run public safety stuff that I think people were looking for after the murder of George Floyd. But I think after doing this work for 1 year, this is the low-hanging fruit. Like, this is the stuff that we can do to make a huge impact on a big group of people, and make a lot of folks' lives better and increase the safety of a lot of folks. If we look at the percentage of folks who are people of color that we talked about tonight, who are interacting on such a regular basis with law enforcement, if we can reduce those interactions, that's a real serious impact on the benefit of some people's lives. So anyway, I will gush about this work. I will get excited about this work because it directly impacts me professionally and personally. But just know there's multiple funding streams available for this kind of stuff.
Thank you. And Lieutenant Roberto did tell me kind of offline that he would help us shepherd this through that process. So he's here as a resource to the commission if we want to move forward on that. Commissioner Sparks.
Hello. I just wanted to make a comment about the funding. It's an exciting discussion. It's kind of what I signed on to hear. So I'm really glad to hear from everybody about it tonight. But I just wanted to make a comment that, professionally, I work in the healthcare space, and in a previous role, I worked a lot with a teams of nurse practitioners who would be in basically a public health plan, and they would interact with people who were frequently unsheltered. They would be covered by a health plan from the state or the county, and they would basically go find these people wherever they were to provide healthcare services. And it was an interesting role. I learned a lot. It was very eye-opening for me. But the main thing I learned is that the shelter for people who have chronic health conditions, mental health, physical health, diabetes, high blood pressure, stuff like that, is probably, I mean, I think I decided myself, it's probably the number one determinant for their health outcomes. If you don't have consistent shelter, a place with an address, those services can't come to you. You can't see a doctor, you can't get a prescription filled. And these are the people who are going to the emergency room 3 times a week because they're in a diabetic coma. And you want to talk about the exorbitant public expense that becomes, even if you don't care about quality of life, these people as individuals, anything else, the expense. I mean, an emergency room visit like that is in the tens of thousands of dollars. And it can be expensive, I suppose. The initial investment that we talked about is a drop in the bucket compared to the expense of just letting these people fund for themselves and get into the system. The benefits are absolutely massive of having something like Familiar Faces, just a place where people can go, even if it's only intermittently successful. It's a hugely positive investment. The cost savings to the public is enormous. The quality of life improvements are incalculable. It's hugely, there's nothing bad about it. There should be nothing controversial about it. And there just shouldn't be. So I do, sometimes people talk about that kind of thing, like the sober living, harm reduction type of stuff, like sort of in my community where I live, they don't like it because they just think people aren't being responsible or whatever. And I sort of lose my patience when I hear that side of the argument, because the real answer is that these are relatively inexpensive, quite frankly. And the benefit is so high, it just seems like an absolute no-brainer to me. And I think if you talk to almost anybody who's actually worked in the health field or the public service field, anything like that, that seems to be the prevailing opinion.
Thank you. Commissioner Sylvester?
Commissioner Sparks brings up a really great point about housing, and housing being shelter being the crux of so many people's issues. One of the things Lieutenant Roberto didn't talk about tonight, and there's some really cool kind of online resources about that, is the homeless action team that he was instrumental in creating at the Metro Transit Police Department. And the HAT team, because they are connected to Metro Transit Police Department with the Met Council has access to a tremendous amount of housing vouchers. And so, and I've been on ride-alongs with the homeless action team. I know these guys, we work with them. They will literally take somebody who is unsheltered, living on a train, and because they have direct access to these housing vouchers, they will put people in an apartment within like a month. And they will work with bridging to get them furniture, and they do all this stuff. And it's just incredible how they've broken down all of the different barriers between finding somebody who is unsheltered, who needs services, and putting them directly into an apartment where they can be stable, work on their medications, work on their criminal cases if they have them, work through these kind of minor misdemeanor issues that they might have, and really keep in touch with these folks and really stabilize these folks. The work that they're doing in that space alone is just breathtaking. And it's the kind of work that you look at it and you say, why isn't everybody doing this? Because everybody doesn't have a Lieutenant Roberto, kind of leading that effort. So that's the kind of person we're talking about here. That's the kind of effort, the kind of knowledge, the kind of experience that we're hopefully going to be tapping into here.
I would probably need to wrap up this piece of our presentation, but I want to say this is a very specific, narrow slice of what we might do to address nuisance misdemeanors. There's some other options for us that I can think of, and maybe others would have other. One thing I would like to propose, so just taking the Familiar Faces project, what I'm hearing is resounding support. So I think it would make sense for us to somehow just sort of escalate this to council and the mayor, and just kind of say, here this is, and please call Lieutenant Roberto, and he's kind of got all the information. I don't know how else to really move it forward, but that's kind of my best idea about how to do that. So if folks are supportive of that, does anyone want to discuss that? I could make a motion if folks think that would be worthwhile. Well, I'm seeing nods. I'll make a motion that as the chair, I will just write sort of, I will reach out to council and the mayor's office and kind of summarize this presentation and provide Lieutenant Roberto's contact information, and just sort of say that we as a commission support this and we hope it can move forward. Any discussion on that motion? Then any second to that motion? Okay, maybe we're not ready for that to do.
I'm sorry, this is Vice Chair Sparks. I'll second on that.
Thank you. Would the clerk please call the roll on that motion?
Commissioner Crockett,
Aye.
Commissioner McGuire,
Aye.
Commissioner Pino, Commissioner Sylvester,
Aye.
Vice Chair Sparks,
Aye.
Chair Sarah.
Aye.
There are 5 ayes.
Great, that motion passes and I will take those next steps. Thank you very much for that. Now, having said that, that only addresses a very narrow sliver of the population who are impacted by nuisance misdemeanors. There are some other steps we can take. One such step is recommending that council consider decriminalizing these nuisance misdemeanor offenses. We can see the major racial disparities and how these are enforced. But loiter was the most stark. Loiter was almost exclusively Black individuals being arrested and cited, and all of the others exhibited very significant racial disparities as well. Now, there's a whole number of reasons that go into that, and poverty, sociology, law enforcement. There's all these things, but if we really want to cut it off and really just intervene, I think council should consider decriminalizing some of these nuisance offenses. And there is precedent for that. A couple of years ago, they looked at the spitting ordinance. It was a misdemeanor to spit on the sidewalk. And it was also enforced almost exclusively against Black individuals. And council just took it off the books. They just said, it's not enough, we're not going to do this anymore. So there is some precedent. That's one idea I had I'd like to bring up. Does anyone have any discussion, thoughts, anything they'd like to say around that? Does anyone think that's bad? You don't have to agree with me.
Commissioner or Vice Chair Sparks, or I don't know if I'm supposed to call myself Vice Chair or not. I'm totally uncomfortable with that whole thing. But yeah, I think it's a good thing. I think at least if we approach council with it, it brings a lot of attention to the issue. I mean, hopefully, and it makes a lot of sense. I mean, why are we wasting all this time and resources on enforcing what are really very? I mean, they're nuisance misdemeanors, right? It's very petty. It seems petty. I think it would be a good thing to approach.
Thank you. Any other discussion? Then I'd like to make a.
Sorry, I came in late. It's Commissioner McGuire. I just wholeheartedly agree. We should bring it to the council. I would just appreciate if anyone with a more criminal background would have any other a reason not to decriminalize it, such as if this is like a lesser plea to other offenses or something along those lines. It's just not an area I'm familiar with.
Commissioner McGuire, that's a super good point, and we actually brought that up in subcommittee with Professor Moran when she spoke. There is some tension around that, like having the opportunity to plead to a lesser, sometimes there's a benefit to that. But what she said is that sometimes that has the reverse of the intended. So really what's happening is that the individual didn't commit a crime. They were, whatever. Like, they weren't harming the community. They were perhaps being loud or disruptive or something. And so by offering this lesser, like disorderly conduct or loiter, you're criminalizing behavior. You're still giving them that misdemeanor conviction, even though it's lesser than, a trespass or something. But you're still bringing them into the criminal court system. And so what Professor Moran opined is that on balance, any benefit of having that lesser charge as an option, on balance, it actually doesn't become a benefit. It actually, just serves to increase the number of people who are in the criminal court system and pleading guilty, and then they have fines, and if you don't pay your fines, you can lose your license, and the spiral. And also, just to say, I'm only kind of talking about bringing this up to the council and just sort of giving this to them and saying, hey, would you like to discuss this? They might do a study and say, yes, we'll get rid of loiter, but not whatever. This isn't definitive, is what I'm saying here.
Well, would you want to bring it up to the council now, or would you want to wait until next year? There's quite a bit of turnover.
That's an excellent point.
They may not choose to pursue it. I don't know.
I guess, if I'm honest, I feel some urgency. I feel like it's been 18 months since Derek Chauvin committed the murder of George Floyd, and our city's been on fire, and we've all been here in earnest trying to find some solutions. So I guess, to be honest, I do feel some urgency. And even if this council chooses not to act on it, I would like to at least say something. I don't want to just sit on my thumbs. We've missed so many meetings. We haven't had quorum. I just would love to move something forward. That's how I feel. I'd love to know what other people feel.
I agree that we should take some action now. I think it's something we could, renew in front of the next council, but if there's anything this council can do, they can initiate it. If not, we've had to lay the groundwork to revisit it.
I completely agree with that. And I think there's nothing wrong with bringing it up now. And if it gets pushed to the side, then there's nothing wrong with bringing it up again in January or February.
Okay. Well, then I'd make a motion to just bring up the possibility to council of decriminalizing nuisance misdemeanors and providing this data, and inviting council to engage with PCOC in that discussion if they choose to. Is there a second?
I'll second.
Would the clerk please call the roll?
Commissioner Crockett,
Aye.
Commissioner McGuire,
Aye.
Commissioner Sylvester,
Aye.
Vice Chair Sparks,
Aye.
Chair Sarah.
Aye.
There are 5 ayes.
Thank you. That motion carries. I will bring that up to council. Does anyone else have anything to say or suggest or discuss around nuisance misdemeanors? Okay. Hearing nothing, I'll move on to our next order of business, which is the arbitration discussion item. This is something we also discussed in the full commission previously. I don't recall which month. We sent it back to the Policy and Procedure Subcommittee for sort of further research. We kind of did as much work as we could do, and so now we're bringing it back here for the full commission's consideration. Just kind of a refresher. The city of Minneapolis, since 2005, has had 26 arbitrations with the Minneapolis Police Department. So of those 26 arbitrations, the city prevailed in 16. The terminations were upheld. So we won. So we won in about 2/3 of the time. The remaining 10 the city, the termination was overturned. So you might say the city lost, or the officer was reinstated. What we decided to do, what this commission decided, asked the Policy and Procedures Subcommittee to do, was to look at those 10 and just to kind of see if we could isolate any issues or what we might discover. So as best as we could, we attempted to look at those 10. We still haven't received all 10 decisions from the city, but we did receive actually 8. We did receive 8. And we also know the outcomes of all 10. So here's what we've discovered about the 10. 9 out of 10 times, the termination was overturned and the officer was reinstated. However, discipline was imposed. So, it was something less than a termination, but there was discipline, which of course is public record, and it goes in the officer's file, and it could be used for future arbitration if it ever came to that again. Only one out of 26 times was the termination upheld and no discipline was imposed. Another way of putting it was that the officer was just kind of completely exonerated of the allegation. So looking at that, I did include as many decisions as we've had in the agenda. I included just some pie charts just to kind of visualize what we're looking at. And I also included some summary data. When Commissioner Sylvester and I were looking at the decisions where we lost, where the city did not prevail, we noticed a pattern, which was that the city in some way didn't follow the human resources procedures or the civil service rule procedures for implementing discipline. There was some sort of break in the process. Sometimes it was disparate treatment, where one officer was disciplined, was terminated for conduct that other officers were not disciplined for at all. Sometimes it was that human resources or internal affairs didn't properly investigate, like they didn't interview a key witness or follow up on a tip or what have you, and so it was overturned in that way. So basically the pattern we were noticing is a problem internally, in-house, with consistently following the rules around discipline and applying them consistently across the board without disparate impact. One officer was Somali American, and it appeared that the police department was treating him differently than other officers who were white. And one officer, they didn't talk about race, but it appeared that that particular officer was being bullied by his superior officers, and so that was like the cause of disparate impact. So there was different reasons for the disparate impact, but end result was the problem is kind of like our HR process. And there really wasn't anything that we could identify that was a problem with, like, arbitration itself, or the arbitrator just inserting his or her personal judgment onto a situation, or it was something like that. It was I've been talking a lot. Commissioner Sylvester, am I sort of summarizing our research properly? Is that the impression you got as you were reading these decisions? Sorry, I didn't mean to put Commissioner Sylvester on the spot, but anyway, that's sort of what we were looking at. So we've been waiting so long to get the remaining decisions, and we don't know when we're going to get them. We thought it'd be appropriate to bring it back to the full commission. And what we would like to do is suggest that we send this to the Audit Subcommittee for a proper research and study to look at the 10 decisions that were overturned, and have a formal research and study with a formal recommendation to city leadership as to what we can do to improve our outcomes in arbitration. And I think that even though these research and studies, that takes a lot of work and they're time consuming, this one would be a very finite data set. It's 10 decisions. There's a finite amount of data, and I think it could happen. It doesn't have to take as long as some of the other major projects that we've opened. So that's what we discussed in the subcommittee. I'm bringing it to the full commission. Do any of the commissioners have any questions, thoughts, suggestions, discussions around that? Commissioner Sylvester. Commissioner Sylvester?
Hey,
Hey, I can't hear you, so I'm going to call on Commissioner Crockett and come back to you, okay?
All right, I was
Commissioner,
voting my.
Did you
Commissioner
get it? Okay. Well, I can go quick. I was just curious.
To me, this is. Can you hear me? Okay.
Yeah, you can go if it's clear. For sure.
why don't you try again, Commissioner Sylvester?
Yeah, is that better?
Yes.
Okay, wonderful. Yeah, I think this, again, low-hanging fruit. This is a great piece, I think, to bring to the council. It's also a great piece to let the public know that this is something that we found. Yeah, I think this is another great way to kind of make the work of this commission known publicly.
Thank you. Commissioner Crockett?
Yeah, so I just had a question within analyzing those 10 cases. Were the situations kind of like similar, or is it just more of the point that the city arbitration or whatnot in the outcome? So is the situations like if all the situations are different, is that a significant variable, or is it just more about like the outcome? So yeah, that's kind of my question.
Yeah, I think it's more about the outcome. There were different allegations at play. Some were around excessive force, some were a criminal charge of domestic violence. One was saying you were in a meeting when you weren't in a meeting. I mean, they kind of run the gamut of what misconduct looks like. The through line was really just that we could see, was just that the process for discipline wasn't followed, or it wasn't followed consistently, I should say. But one thing I should have said is these were really heavily redacted opinions. So I just want to acknowledge that I could have missed some important nuance. I don't think I'm the only opinion on this, or Commissioner Sylvester is the only opinion on this, which is why we wanted to bring it to the Audit Subcommittee. We thought it might be worth your time, particularly if it's in the Audit Subcommittee. Perhaps you could view the 10 opinions unredacted in a private space, not in a public meeting, but off the record, so you could actually read it unredacted. If there's nuance there, there's nuance there, and if there's any findings to present, you could do that. And it would be more accurate for all of us. Commissioner Sparks?
Oh yeah, I was just going to say I think that makes a lot of sense. It'd be nice for our subcommittee to have something to look at that's not a huge study, finite data set, like you said. It would be nice to focus on something that's actually has a start and end point. So I like it.
Anyone else? Any other discussion? Well, without further discussion, then I would like to make a motion to send this arbitration matter, to the Audit Subcommittee to open a formal research and study on the 10 instances where the city lost an arbitration or the decision was partially overturned in arbitration, and to try to do a root cause analysis of what caused the bad outcome, so to speak, and what recommendations we might offer to improve outcomes in future arbitration. Any discussion on that motion? Any second to that motion?
Second.
Madam Chair, if I might, this is Assistant City Attorney Fussy.
Yes, recognizing Mr. Fussy.
Thank you. I just wanted to make one quick comment. Certainly, I think this is an appropriate motion to make, but I did want to, I guess reiterate the advice that I've given a number of times that you do have to hew closely to your ordinance authority to give, I guess, recommendations regarding police procedure. So to the extent it might touch upon procedures or policies of other departments in the city, I don't know that would be within your purview, but certainly to the degree it touches upon disciplinary procedures of the police department itself, I think it would be appropriate.
Thank you, Mr. Fussy. That's a valid point, and I was really speaking of just how we can have better arbitrations with MPD. So I was only speaking of MPD arbitrations. And our mission does say anything to do with policing or that relates to policing. So I guess I would say to the extent that maybe HR would be involved in an MPD arbitration, it seems like that would be something that we could consider as a fuller research and study in arbitration. So I think we had a second to the motion, and taking in mind Mr. Fussy's advice to our commission, would the clerk please call the roll?
Commissioner Crockett.
Aye.
Commissioner McGuire.
Aye.
Commissioner Sylvester.
Aye.
Vice Chair Sparks.
Aye.
Chair Sarah.
Aye.
There are 5 ayes.
That motion carries, and I will contact Commissioner Pino to start that work in the subcommittee. Thank you. So the next order of business is the MPD discipline policy discussion item. This goes hand in hand, and I wanted to have it third on our discussion items. It goes hand in hand with arbitration, because as Commissioner Sylvester and I were reading these opinions, what we were really noticing, the problem was disparate impact or inconsistent discipline. And that was a problem with arbitration. And then looking at existing MPD policy, recently in December 31st of 2020, so just this year, start of this year, there was a change to MPD policy on discipline. And I have attached a document that shows what the MPD policy said last year and what it says now. It previously said that discipline was mandatory. Any sustained finding of misconduct shall result in discipline. And discipline is anything from a reprimand up to a termination. And then it changed and said that the chief can issue discipline, if any, and individuals will be subject to discipline, but that it's not mandatory. And in addition to all the kinds of discipline that existed before, reprimand, termination, all that, there is now an option of coaching. And, coaching existed prior to this year, but this is the first time it's appeared in the actual MPD manual. And the MPD manual now says that coaching is specifically not discipline. And so the reason we do have an open research and study on coaching, but I'd like to just put that to aside for a moment and really just speak narrowly on this discipline policy and not on coaching itself. The reason I want to bring it to the commission is following on the heels of arbitration, we can see that inconsistent discipline causes a problem for the city when they want and need to fire a problem officer. And so having a discipline policy where discipline is optional and the chief can issue anything from a coaching to a reprimand to a termination, I think opens the city up to bad outcomes in future, grievances or arbitrations. I think it really gives the union the opportunity to say, hey, you terminated this individual officer, but this officer got coaching, or this officer got, a reprimand. I think it really undermines the work that has been done around establishing a discipline matrix, establishing consistent outcomes, and, all the work that the chief has done in that space. So I just wanted to bring this to the commission and open the floor for discussion. So would anyone, Commissioner Sparks?
Hey, so to me, has anybody talked to you so far about why that would be a good thing? Because to me, it only seems like a bad thing, right? When you have that inconsistent, why have a discipline matrix at all, right? If it's all going to be subjective and 100% up to the chief, and he or she can intervene where they see fit. It's like you said, it kind of throws everything in the trash, right? It's like, yeah, we have the window dressing, but the chief can kind of do what he or she wants. Has anybody said anything other than that? What have you been hearing?
No one has said anything to me directly, Commissioner Sparks, and that was sort of a problem because we were talking about coaching and discipline back in August and September of 2020, and we asked to be part of sort of ongoing discussions of what was going to happen around that. And there was supposed to be a working group with, you know, city leaders, and PCOC was supposed to be at the table, and that working group was never convened. And then the city, the mayor and the chief made this change to policy, and it was run by city staff, including the Civil Rights Department, but it wasn't presented to the PCOC, and it was never discussed with the PCOC, not to me as an individual commissioner, nor at, you know, not at like a public meeting or anything. We just sort of discovered it. So yeah. No one said to me directly, you know, I've kind of heard what people are saying to reporters is, well, coaching has existed for quite some time and this is what we do. So really we're just codifying our practice that we've been doing for all these years. But I guess to me, that doesn't sound like a good thing. That sounds like a practice that wasn't serving us well. And so just codifying a practice that wasn't serving us so well doesn't seem like progress. It seems like a step back.
Yeah, I have the same feeling. I would be very interested in what the counter argument is to that. I love to have my my assertions challenged.
Commissioner Sylvester.
I made mention of this in the subcommittee, but I also talk about it here. My concern with this is what happens at the precinct level. And, you know, the idea that, like, you know, Jim is a good guy and Jim was having a bad day and Jim, you know, is going through a rough patch in his life. So we're just going to coach Jim and we're going to institutionalize that idea of understanding that Jim is just a good guy and everybody likes Jim. And so Jim only gets coaching in these situations. That's my main concern with this is how do we understand what is, like, how do we differentiate between what happens on a precinct level and a department-wide level?
That's a really good point. Any other comments or thoughts? Okay, well, I guess, you know, I've been making a lot of motions, but I'm going to make another motion. I would like to make a motion that the PCOC recommends that the chief and the mayor reconsider this in light of arbitration outcomes and we scratch that. Maybe the better thing to do, so this is a discussion, I'm not making a motion, I'm discussing. Maybe the better thing to do is to include this as part of the arbitration research and study and have, you know, item A be the root cause analysis and item B is how does this discipline policy impact, you know, up or down, you know, how does it impact our outcomes in arbitration? Any discussion on that as an idea before I make a motion?
It's a great idea.
Yeah, I think it makes sense. What I'm expecting to find, and again, I love my expectations to be challenged and thwarted. I like to try to think differently, but what I'm expecting to find for those arbitration decisions that didn't go the city's way is that there was essentially a paperwork impropriety, right? Or they didn't follow the correct process for discipline, or they were able to find, the officer was able to find examples of discipline being applied unevenly. stuff like that. And it would seem like this policy change would only reinforce those decisions that don't go the city's way. So it would be something that we could take into account.
Thank you. Okay, so with that, I would like to make a motion to the commission to add a sort of a secondary part to the arbitration research and study with the audit subcommittee that asks the question, how does the new discipline policy impact, or does it impact, our outcomes in arbitration, to include that as part of the research and study analysis? Any discussion on the motion? Any second to the motion?
Second.
Would the clerk please call roll?
Commissioner Crockett,
Aye.
Commissioner McGuire,
Aye.
Commissioner Sylvester,
Aye.
Vice Chair Sparks,
Aye.
Chair Sarah.
Aye.
There are 5 ayes.
Thank you. That motion carries. Okay. Next is public comment. We were supposed to have a staff report, but I don't think we're going to have enough time for that. So the next order of
Excuse
business.
me, Chair Sarah, would it be possible then to release the staff that's on the call?
Absolutely, and my sincere apologies for holding them all this time. The next order of business is the acceptance of public comments. I will open the floor and invite comments from the community. We'll limit the public comment period to no more than 2 minutes per speaker. With that, are there any community members on the line who wish to address the commission?
Hello, this is Dave Bicking. If I can make just a brief comment. I think the PCSC is doing excellent work on all 3 of these topics. I really appreciate your efforts on that and the way you're moving things forward. I also want to express a great appreciation for linking to the Jones Day City of Minneapolis contracts. Those are very important. We're finding out, I believe, new information on that hasn't been available in general to the public. And I appreciate your linking those to the agenda and even being able to obtain those in the first place. On the matter of the arbitration, yes, I sent to the Policy and Procedure Subcommittee what I was able to find at the Bureau of Mediation Services going back about 15 years. Were 15 arbitrations that are available to the public without any redactions. If you can't link to those to the agenda because of the city attorney's opinion, I hope at least those are things that you'll be able to take a look at in the audit committee as well. I think I hope to be able to undertake some analysis of those myself and might provide that analysis to you as something you can include on an agenda at some time in the future. So all of this is very important work, and I thank you very much for it.
Thank you, Mr. Bicking. Anyone else with public comment? Please press *6 to unmute yourself, *6 to unmute. Any other community members on the line? I see Commissioner Sylvester.
Thank you so much. I just want to recognize Mr. Bicking and all his work on these issues and how much he has educated me over the last year as I kind of struggle to grow on this commission. Mr. Bicking is an inspiration in this workspace, and I really appreciate everything that he's taught me so far.
I second that, Commissioner Sylvester. Mr. Bicking has given quite a bit of really important information to the full commission and the subcommittees. Thank you, Mr. Bicking. Okay, would anyone else like to address the commission? *6 to unmute yourself. Okay, I want to thank all of our speakers tonight for their comments. And I would ask the clerk to report and file those public comments. The next item for business is staff reports, but we've released staff. One of the questions that staff was going to update us on was some issues that people are having with getting their stipends. So perhaps that can happen offline. Perhaps there can be an email sent around, or something like that can happen. There was also a question of whether the city is requiring employees, specifically MPD employees, to be vaccinated, and what percentage of MPD employees are vaccinated. I haven't received that information myself, so I can't provide it. Perhaps that is something that could be provided at the December meeting. And then the final item was asking how the PCOC can participate in the chief's performance review. That's part of our operating rules. So perhaps that is something that could happen offline, or, Mr. Fussy, did you want to be recognized on that?
Thank you, Madam Chair. I could address that quickly, although I don't have a specific answer for you. That's not your participation in the chief's performance review. That's nothing that's been defined. I know historically that other commissions have, for instance, just submitted a report that they've put together in one of the committees regarding their view of the chief's performance. I think if you look through past agendas, you might be able to find some examples. I know that a more recent commission at least had some discussions with the mayor's office. I don't know to what extent they participated in a performance review. I don't know if that ended up being a consultation or a discussion that was had, but I know that they followed up with the mayor's office. And frankly, I know that some commissions just didn't have it in time or did not address it. So I don't think there's a firm answer, but you certainly would be able to try to follow up either with the mayor's office or to look at some of those historical precedents, or to simply just submit something of your own initiative.
Thank you. Thank you. Suppose we should just reach out to the mayor's office in that case. Okay, so we also had an audit subcommittee report, but Commissioner Pino is not here. Would either Commissioners Sparks or Crockett like to give an audit subcommittee report?
Yeah, I can give a report if it's all right with Commissioner Crockett. So I can give a quick update on the two studies that we're working on right now. So for the no-knock warrants, the study is proceeding, but it's kind of slow going. Data on those warrants is not centralized. Staff has to look in several different locations for them, but it is proceeding. And I have a note here that the group No Knock Minnesota, one of the suggestions that they've made is to have all that data centralized, and I think it's a good suggestion for anything we do in the future. A lot easier to research when all that data is in one place and we don't have to check 20 different things. As far as the coaching study, we remain hindered by the ACLU versus Minneapolis lawsuit. So it's ongoing. We can't release, we don't have access to a lot of new information about coaching. And then if I remember correctly, we can't currently look at data newer than 2016. So we, and Mr. Crockett jump in, or Mr. Band, if you're still here, if I got that date wrong. But so at the moment, we're just looking at the data that we can. And then in the future, when that's all resolved, we'll look at more current data and we'll pull that in. But we're just going to proceed with the historical data for now and do everything we can with that. Chair Sarah, I think you're muted.
Thank you. Okay, so litigation, in short, litigation is ongoing, and so you're not able to look at coaching data, basically.
Right, there's some discipline data we can look at only up to a certain point, but we're doing what we can with that.
Was there any update on the trans equity partnership research and study? It was open before your time, actually, but.
You know, I feel like there might have been, and I can't remember it.
Okay, we'll bring it up.
Vice Chair Sparks, I believe the update was that Cassidy Gardner was on leave, so therefore was not available to update on that. And there would be an update next month.
Thanks, Lisa. I appreciate it.
Thank you. So we'll have an update in December. Okay. Any other updates from the Audit Subcommittee? Okay, with that and without objection, I will direct the court to receive and file this report. I will recognize myself to present an update on the P&P subcommittee, which was pretty much this meeting. Like we had done quite a bit of research over the past 6 months, and it was time for us to bring it all to the full commission. So, I mean, that was really the crux of what we did today. So I would ask the clerk to please file that report, just noting that all of our issues in the subcommittee have now been brought to the full commission. And I will recognize myself to give a chair update. Vice Chair Sparks and I did meet with the city attorney in Jones Day this morning. It was our first time meeting, so it was just sort of a high level, but talking about work that Jones Day is doing for the city. Commissioner Sparks, did you want to give just a really super brief summary of that meeting?
Yeah, and definitely jump in if I forgot anything. But it was just a short sort of kickoff meeting, hopefully one of many to come. We're planning to meet regularly probably every month or two, I think, is what the plan is going forward. The main takeaway that I had was that the scope of Jones Day's work for the city of Minneapolis was larger than I think I had anticipated. I think the justification for that was that they're using Jones Day to fill some staffing gaps that also happen to have coincided with a lot of pending litigation and a major backlog in investigations in several other areas. But they advised us that they are involved in the following activities. So that would be involvement in the labor contract with MPD, the negotiation, arbitrations around police officer discipline, the DOJ investigation, the MDHR investigation, and the MPD para disability claims. So they're heavily involved in those 5 things.
Thank you. I would just like to say that I wasn't aware at all that Jones Day was taking on OPCR investigations. And just as a point of discussion, we currently have no head of the Civil Rights Department or director of the OPCR. OPCR, of course, is understaffed. So, I don't have a motion to make, but I guess I would like city leadership to consider staffing the OPCR and the Civil Rights Department so they could carry out their work rather than contracting it out to a private law firm. It seems like better to just staff our own departments and kind of let them do their good work that they always do. And we will continue to meet with them, as you said. We also, Vice Chair Sparks and I have a meeting with the Federation this Friday, I believe. So those are some of the chair updates that I have. And I do see we're at time. So with that, without objection, I will direct the clerk to receive and file this update. With that, we've concluded. I think I got through all the items on our agenda for this meeting. I declare this meeting adjourned, and I'll see everyone back here next month for the December 14 regular meeting. Seeing no further business to come before us, without objection, I will declare this meeting adjourned. Thank you, everyone, and good night.
Thanks, everyone.